Hi, I'm Pam Smith from San Diego County Health and Human Services. I'm here to show you our exciting new online tools for schools. Developed by our Live Well Schools team with a lot of input from school personnel, it's an incredible place for schools to access important resources about HHSA programs and services, community partners, and other relevant data and information to help and support the school community. Live Well Schools is an initiative of Live Well San Diego, the county's dynamic vision to create a healthy, safe, and thriving region. We know that the professionals who work in education, social services, and public health are caring, thoughtful people who chose these fields because they care. But too often our systems or time constraints or simply not knowing where to start get in the way of coordinating our common goals for our shared population. Live Well Schools and the Toolkit are tangible efforts to get to those common goals, build strong partnerships, and importantly, establish trusting relationships so we can use collective impact to support healthy schools. This is our third edition of the Toolkit and the first online with, at school's request, a searchable resource database to easily find what they need. We are committed to partnerships for healthy schools. San Diego County Office of Education has been an invaluable partner in schools and has collaborated with us on their annual summit on student engagement and attendance, which now has become an important part of HHSA's annual Live Well Advance. Our toolkit's home page frames our guiding principle of health equity with a recognition that children's health behaviors are influenced by the choices and opportunities available in the places where they spend their time, where they live, learn, and play. But we all know that these environments are not equal. Our goal is to work towards equity and social justice. There's also increased recognition that adverse childhood experiences are strongly associated with increased health and social risks. The data from the ACEs study tells us that creating a trauma-informed system of care in education is crucial. Let's take a look at what's in the toolkit. Our strategies were developed with a lot of input from schools and are about policy, partnerships, programs, and the local control and accountability plan. There are a lot of great things going on in schools for health and wellness, but unless there are strong wellness policies, adherence to those policies, and resources to support them, it's difficult to achieve systemic change. Many schools' policies start at the federal and state level, and health and wellness does too. The federal Every Student Succeeds Act provides block grants and strengthens requirements to tackle health and wellness challenges in Title I schools. At the state level, California uses the local control funding formula to give local districts more autonomy and flexibility with their budgets. The 3-year local control and accountability plan focuses on resources and outcomes for low-income children, English language learners, and foster kids. The district policy level is where the rubber meets the road. Our Live Well Schools team has done a lot of work reviewing and analyzing in 3 critical areas. For the wellness policies, we use the Rudd Center WellSat tool to score the strength and comprehensiveness of the wellness policy for every district. We developed a model policy and shared best practices. As districts have updated their wellness policy, we have analyzed trends. It has been exciting to see that in all districts that have revised their plans, there has been tremendous improvement. We've also analyzed 3 years of LCAP spending for health and wellness and documented those trends. More exciting news here as districts are committing more resources to support student health and wellness. Our analysis shows the specific areas of these spending. We have also tracked and analyzed chronic absenteeism for every district for the 2 years that have been reported to the state. Importantly, we have disaggregated that data to help schools better identify and support those who need the most attention. We have combined the findings in these 3 areas in a Partnership for Healthy Schools report for every district. A sample report is in the toolkit, and there is a link to my email so districts can request the reports for their districts. Another key strategy is partnerships. Schools, you are not in this alone. This section really has a wealth of partnerships that can help and support schools. 211, our San Diego County Childhood Obesity Initiative, First 5, Oral Health are a few. Here's a unique one that we have developed, support for kinship families. We know that we have over 20,000 grandparents raising grandchildren in this county and are responsible in some way for children under the age of 18. And in many of these cases, they have primary responsibility for these children. So we have established a network, a system to help support these kinship families. Includes educational forums, enrichment events, and kinship navigation, a system that will help them find the resources they need. We need schools to help us connect with these kinship families so they can find the resources that helps them. Another key partnership program, a new one this year, is Live Well on Wheels. So HHSA has established a mobile van that will be able to go into areas and communities, and it offers enrollment services for public health benefits such as CalFresh, Medi-Cal. It will have immunizations, health screenings, and a lot of other information about community resources. We just rolled this out recently, and it has been a tremendous success, and so the county is going to be expanding this program. We really developed 4 focus areas when we worked with the toolkit. Chronic absenteeism, which we talked about, and in this section, if you click into it, you'll go and get more in-depth information about chronic absenteeism. Wellness policies also very important, and more information about what should be included and how to strengthen policies. Social and emotional health is a critical issue for schools. The top issues and needs we hear from schools were related to behavioral health. Mental health and substance abuse are critical issues, and this section is a goldmine of resources to help schools. Starting up here with the overall programs that our behavioral health team have, those that are school specific, and this section on School Link is just terrific. You can go in and really get a look at the different areas of social and emotional health, what you can learn about those areas, and how to access services that help and support in those critical areas. I encourage you to spend some time here and really look about how we can strengthen our connections in these behavioral health areas. We also have a section on childhood obesity. We know it's a critical problem in this country and also in San Diego County. We have the power to make health happen. Place matters. Health equity is at the heart of these issues. Disparity among children who are overweight and obese persists, particularly among diverse racial, ethnic, and economic groups. There are so many factors impacting this, so we have to have coordination for collective impact to turn this ship around. It is shortening lives, reducing the quality of life, and creates exorbitant costs to our healthcare system. Our Tools for Schools resource area is really where all of these ideas lead. helping schools find the resources and programs and partners to work with. We frequently hear from schools, who do we call? What is available? Where do we start? Well, start here. We have over 200 resources listed with links to their programs and contains a wealth of information, data, and best practices for health and wellness. When you go to it, you'll see all these sources are alphabetical, but you can go over here to the search box and let's type in food here. And immediately what you will see pop up are all kinds of programs about food and nutrition services that would be available for schools. You can go over here and show how many entries at a time and expand it and take a look at other areas. Again, you can go into behavioral health, physical education. It's a terrific area. Take a look at this and give us your feedback. A link to my email is in several sections of the toolkit. We will continue to work hard to make this toolkit meet schools' needs. We are excited to continue this journey with schools and are committed to this ongoing process. Live well, schools.